Well, Andrew, welcome back. We're doing this for a second time. For those who haven't seen the first episode, would you mind introducing who's Andrew? What do you do? Who are you?
Okay, thanks for having me for a second time. I'm Andrew Abdelmalik. I'm from Egypt, and I'm an instructor for Schross method, as we mentioned in the first episode. I'm dealing with scoliosis patients, and I'm a patient myself. I have a clinic in New Cairo, and giving education for therapists, or physiotherapists, or even fitness coaches, and for medical doctors about scoliosis in the Middle East.
That's amazing. So, we spoke a lot about scoliosis in the first chapter. Give people a review quickly of what scoliosis is, what to look for, and then maybe we speak about the entire ecosystem that handles clients or patients with scoliosis.
So, as we mentioned in the last episode, that scoliosis is side shifting that appears on the body, and they found shoulder blade higher on the other side, find pelvis or the waist is higher on one side to the other.
Some sort of change.
Exactly. So, and we go to the orthopedic doctor. Orthopedic doctor diagnose through forward bending. So the patient is going down, and if he sees the spine, if he suspects that one side is higher or the spine shifted to the other side,
one side of the rib cage is higher, right?
And maybe
the pelvis.
Maybe down. Yes, exactly. And from this point, he asks the patient to do this X-ray. So he have a full spine X-ray, and this is scoliosis.
Meaning, once they see the full spine X-ray,
Yeah.
and they see that as you look from the front, the spine has these curves,
Yes,
right
exactly.
and left, meandering like a snake almost, instead of being like a pillar in a forward to back X-ray, then that will be diagnosed as scoliosis. And there are many types of scoliosis, correct?
Exactly, and many shapes and many type even regarding the age. So the majority
Right.
of patients are in adolescence, but there are juvenile. So we have from 0 to 3 years old, we have scoliosis. We have from 4 years old till 9, and this is juvenile. This is more progressive. That's why we have to check our children. And we have from 10 to 15, this is adolescent, and we have more after 45, 50 for de novo scoliosis, so scoliosis in adulthood. Sometimes it happens to the adults too.
Suddenly, this is not something that is
as a progression from an old one, or from they have a scoliosis and they already progressing during adulthood, or a new one. So from a good spine, nothing at all, and after 50 they turn to have 30 degrees with much rotation in the spine and pain in the legs. So they have,
I see.
Scoliosis with adulthood.
So they had a new, not a
Some
straight
of them,
spine.
Some of them straight spine, and some of them progression
from previous.
Yes, exactly.
Okay, from a previous diagnosis. Maybe they've dealt with it for a while, maybe they didn't,
Exactly.
but all of a sudden it accelerates.
Yes.
The age, I think, is an interesting insight. At 45, 50 years old, is that what you're saying?
Yeah, around
that age. And I think it's especially interesting because most of the patients with scoliosis are women, correct?
Yeah.
Last time you mentioned the ratio is 2 to 1. For every 2 women, there'll be one man.
Yeah.
And there's a lot of hormonal changes. There's a lot going on during a woman's life around that age. Premenopause begins to happen.
Exactly. Osteoporosis. Maybe they have
Osteoporosis.
osteoporosis. So their bones are weak.
Right.
And they can collapse.
Right. So one thing I want to plug in here as a reminder for all women out there and men alike, training is not just about the muscles. Strength is not just about the muscles. When we train, we positively impact every single tissue in our body, every single one of them, even the stomach tissue, even any single thing that you think about, whether it's bone, ligaments, joint, cartilage, the muscle tissue itself, nervous system, and of course, this the hormone balance in our body is very different. So we just see right now through this insight, I bet that those who were probably a bit more active and they had a bit better bracing, a bit more support to their spine, chances are their risk might have been a bit lower than those who maybe, in other words, there probably is a correlation between, and you need to tell me because you're the expert, is there a correlation between people who are not active and then they relapse or they acquire de novo scoliosis, or can it happen to people who are just active and all of a sudden is there a difference between the two populations?
Scoliosis could happen to anybody, but if we have, could you imagine an adolescent that he has scoliosis, but he's practicing swimming, he's playing football with his friends, so this coordination, so his brain is ready to move, how he moves his body, he's already have this mindset that to do something to his muscles more strong. So could you imagine I'm doing session for this kid or one kid that's just eating unhealthy food, they doesn't do anything all over the day, and they don't have any hobbies, any interest, and who is more dedicated to have a good treatment and who will have a better treatment at the end? Could you imagine?
There are differences. There are differences in the attitude here. So I think we're gently moving into the topic of how do you work with other professionals when the patient might have a different challenge that is not just scoliosis, but maybe they are overweight. Maybe they do very little activity and they should do more. How do you go about connecting with other professionals to help your patients? And do your patients want that help from other professionals?
Yeah, so first of all, I think in this world, if you are not a team player, you won't achieve good results. So we have to deal with other professions and just for the sake of the patient health. And our aim, my aim always is the patient or the client is satisfied and he has to have good quality of treatment. So in my assessment, in the first time, I go with asking them about what you do in your life. So what are the environmental factors, even psychological factors, and what kind of sport you do. From this point, I know, okay, you do swimming, and I try to contact swimming academy that I know, and we are on the same line together. So I find a patient with is obese or having high BMI. So I have in my team a nutritionist, and the nutritionist deal with this. So we're trying to make the patient comfortable, and he has all the solutions in front of him. So whoever wants the best thing for him, yeah, I offer you. I have a psychologist, I have a nutritionist, I deal with surgeons very well. I'm connecting with them very well. And what I think that helping me to connect with either surgeons and medical doctors or fitness coaches, that I go to their conferences. So I meet with them.
Wow.
I meet and connect. So we have to have better quality of treatment.
That's very interesting to hear, and I'm deeply grateful for that perspective, because it's one that is not only one that we share, but it's one that you're absolutely right. If you're not a team player, it's going to be very difficult to help human beings. We are very complex beings. We have challenges that come from different aspects of our life. And one issue doesn't mean that affects us only one way. Like you mentioned, there is a psychological impact, isn't there?
Yeah.
And imagine that you would treat this person just like a machine rather than a person. Oh, you have a shoulder that's a bit elevated because of it's a bit up because your spine has curved a bit. Instead of understanding that actually the person looks at themselves in the mirror and they can't control it but the way it is. They would want it to level up, to just drop, or the other one to rise, but they just can't do it. And that takes a toll on a person. So psychology, how big of a component is it with your adolescents coming into the clinic for the first time?
Supporting them through going to more active life, and it makes them more open to the world and more open to do something, and they feel they are normal. And through my words, I always mention what's right. So I don't say any words that hurt them or that makes them feel weird. So I'm a patient. I have scoliosis, moderate to severe scoliosis. So I always show them on my body what's happening, and it's fine. I'm living, I can do anything, I can do any sports, there is no restrictions, and everything is good. So I support them through this. And then the psychologist, if we have more severe things or we have a patient with brace, we could support them through psychologist. So the psychologist plays this game that we have a group therapy with her, and they are playing games, spending time together, having their braces on together, and she checks their behavior and what's happening, and even the relation between the child and their families.
Oh, wow. You're right. That is no longer just about the individual. They need a support system. So it's not just a support system that we need to recruit from a, let's call it, medical or wellness standpoint, but there's also a relationship with the family. What does this mean for a family? When a family goes through this situation where their children or a child is going through this situation, they are diagnosed with scoliosis, what does that mean for the family?
Normally, they don't understand much about it because they are like shocked. So
It's unexpected.
From nowhere, I find my child is shifted and having higher shoulder, and he's not happy about his shape, and they are afraid for progression to have worse and worse shape. So they are shocked, and they stay in this phase for, I think, not short time till they deal with a good medical team or a good team that supports their child, and they found good support, and they convinced, okay, it's fine, nothing happened.
So understanding what's going on helps them a great deal.
Yes, exactly. Even for the surgery. So sometimes I have patients from the first time, I know what's better for them. So I say, okay, I couldn't support you with anything and you have to do surgery. So the families keep insisting, but it's fine. I know what's better because you are very, very severe curve, and later on they come to me and they visit me, and they are very happy with this decision because this was the most suitable for them. So trying to eliminate errors is my definite goal, to be honest.
I want to be very clear with our audience. When you say, I'm going to recommend something because I know, what you're referring to is the scientific literature.
Exactly.
Correct.
So the medicine has changed in the latest, I think the last 20 years, 25 years, is to more evidence-based medicine. So we have researches and literature reviews. We have many updates. Every day we have updates, especially after COVID-19. So we find this accelerating very, very quickly, and we have to catch it. And many researchers from all over the world that support the treatment, trying to find solutions. So either surgery, conservative team, we have to keep up with this.
So there's a lot of focus and attention from the medical community on spine posture. Do you have people who reach your clinic with kyphosis, which is this bending of the spine forward to the point where the head basically hangs in midair instead of being stacked over the neck and over the spine, but rather they have like a humpback, basically, bilaterally. It's not just one side anymore. Now it's on both sides, and they're arched forward. Do you see such situations as well?
Yeah, we deal with all spinal deformities. So any different shape of the spine, we deal with it. So we have many patients like this. So the majority of them are males. It's different than scoliosis. And it could happen even for elderly, but maybe it's hard to help them, but we try to support not to increase it.
Yes.
So yeah, we can deal with this.
I think that's wonderful. I think that's absolutely wonderful. And you notice what I want to really drive your attention to is there's integration between your practice and others, but you're focused on one um, area of well-being, and that's spine deformities, and helping people reach a better outcome and learn how to manage with these situations, even though they seem random. And I think it's comforting for those listening that that is happening. There is a place, and there are professionals like yourself and others, Shroth practitioners, because you've been teaching in quite a few places, you and your colleagues from the ISST. So if people are listening to this and you're somewhere outside, you're not in Cairo, you're maybe in Saudi, or you're maybe in another part of the world, definitely look out for a Shroth practitioner. And it's not just about the treatment. You guys have a lot of insight. Like you mentioned, you have to keep up with the science because it will inform how you best help your patients moving forward. I think that's an absolute wonderful thing to do. I admire it, I respect it, and I thank you for your commitment to this endeavor. Really, it's wonderful. It was my honor to learn from you last year when we did the course together.
To be honest, I learned to. So this discussion between us, and to have you and your team. So you are a representative in this course for fitness. And fitness industry is very big, and you see a lot of people. So this is very good to have this conversation and channel of collaborating. So if I have patient and he's going to play sports, and you supervise him in any kind of sports or inside the gym, whatever, and you understand more about scoliosis, so you can help him better. And I feel that my patient is more having safer and safer practicing his sports. And I think I learned a lot about this, and I know that you have much information about what's happening, and I think in this way we are going in the right direction.
Collaboration is key. And I'm glad you said that. Without being a team player, things don't work. We believe in the same thing. And in fact, the people who we see in our industry, I wouldn't say struggling, but not being very effective, is those who become isolated, like they're on their own island, and they don't want to build any bridges to anybody else's island. They just want to be on their own. And if in some traits that works, but we work with humans. We don't work with computers. We don't work with Excel sheets and what have you. And humans are complex, especially if you want to address the problems that people need us to address. Not just what they want us to address, but what they need us to address. We're very committed to this, to the integration of practices. That's why we study. That's why we get to meet people like you. That's why we commit to investing not only money, but time and effort. And we're very fortunate to be able to do that. And as a result, hopefully, we get to help more people along the way. Andrew, I want to thank you so much for today.
Thank you, Mariam.
It's been a wonderful conversation, and I hope more professionals look forward to integrate their practices and understand. And the biggest takeaway for me from our conversation is notice what he said, guys and girls. He travels to attend other people's conferences or other specialties conferences so that he meets and gets to connect with other professionals, gets to understand their point of view. That's what connection means, is if I cannot see the world from your point of view, well then it's going to be very difficult to understand what you mean.
Yeah, different perspective. It's always different perspective, and we have to respect each other. We have to work together because the patient deserves to have the best treatment.
Yes.
And we could work together, so let's make it more easier for us to do it like this, better than fighting.
Exactly. And if for people who are asking, okay, but you know what? Where does this person fall in? Where does this person when does this person want to help? Where does everything fall into place? The science covers that. That's why there are guidelines. We just need to know them. So when people don't know the guidelines, they don't know where they belong. That's the key. And at the end of the day, we need to put the person first, the client, the patient first. It is their life that is actually the focus point here. Is no one's ego. So on that note, till next time, my friend, we're gonna do this again.
Yeah.
And hopefully we'll have some news for our audience as well in the future. In the meantime, thank you so much, Andrew. Thank you, everybody, for watching.
Thank you. I'm happy to be with you.
Same here. And if you want to know more about Andrew, check out Scolio7 on Instagram. Reach out with any questions. And if you have any questions right here, just pop them in the comment section below. And looking forward to seeing you on the next episode.
Bye.